The issue that we are going to be discussing today is euthanasia. Euthanasia refers to the termination of a person's life to end their suffering, usually from an incurable disease or terminal condition. We will be focusing solely on euthanasia regarding the elderly population of Australia, that is, those who are 65 years old and above. There are 6 different types of euthanasia. These include voluntary active, voluntary passive, non-voluntary active, non-voluntary passive, involuntary active, and involuntary passive. Where voluntary indicates consent from the individual, non-voluntary indicates that the individual's choice is unknown, involuntary indicates that the individual has refused euthanasia, active refers to euthanasia being the direct cause of an individual's death, and passive essentially refers to letting nature take its course. Due to the lack of research regarding this topic in Australia, we'll be focusing on information largely obtained from European and American countries where euthanasia has been further considered. Additionally, due to time constraints, we will not be touching on all of the bioethics surrounding euthanasia. However, we'll briefly touch on the principle of autonomy, which outlines an individual has the right to determine their own medical treatment. Throughout this discussion, we will be presenting views on the pros and cons of euthanasia and the theoretical legalisation of euthanasia in terms of patient wellbeing and healthcare spending. The foundation of our analysis and arguments has stemmed from the literary article entitled Euthanasia, Patient Autonomy versus the Public Good. Rather than being a biased piece, this article presents both the positive and consequential factors of euthanasia, which we have utilised to form the basis of our discussion.
Doctors are at the forefront of ethical and medical perspectives of euthanasia. This is evident in studies conducted to examine the attitudes regarding active voluntary euthanasia and physician-assisted suicide. These studies examine the views of the general population and medical practitioners. Although they debate different perspectives, it is evident that euthanasia should not be legalized in their opinion. The largest concern is the doctor's ability to perform euthanasia and whether they have applicable level of training and expertise. Doctors performing the procedure should be mentally prepared to live with themselves and handle the emotional aspects of taking another's life. For most geriatricians interviewed, attitudes towards euthanasia reported 81% considering active voluntary euthanasia never to be justified ethically, and 68% opposed physician-assisted death on ethical grounds. Most physicians oppose these interventions and appear not to be willing to perform them if legalized.
The prohibition against killing patients stands as the first promise of self-restraint sworn in the Hippocratic Oath as medicine's primary taboo. I will neither give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect. The Hippocratic physician rejects the view that killing can be justified with the consent of the patient's death by forswearing the giving of poison when asked for it.
A significant implication of euthanasia and assisted suicide is the effects of healthcare spending, its affordability, and access. Studies conducted revealed that patients opposed the PAS represented a particular vulnerable element of society who were affected by low income and low socioeconomic status. Many elderly patients favored PAS in cases of terminal illness. One key hindrance of this is the family's inability to access euthanasia treatment. Whilst death is cheaper with the legalization of euthanasia, eliminating the cost of treatment and care, a majority will fight to live and pay the cost to do so. Additionally, extra cost of providing drugs for the treatment of death could not only place strain on taxpayers, but also indicate the small percentage of people qualified to receive PAS.
The individuals that are believed to be at jeopardy of indifference, abuse, or mistakes as a result of euthanasia are the uneducated, minority groups, and the poor. They are at risk as they may be a social inequality and prejudice prism in which euthanasia and assisted suicide could be practiced through. For example, terminally ill patients are considered as being at the lowest points of their lives psychologically. They are considered susceptible to abuse and manipulations by relatives, whether it is intentional harm or they believe they are doing the right thing, inevitably convinced or pressure terminally ill to feel as if they are not worthy of living.
Consequences that may arise from the legalization of euthanasia may cause implications on the overall health, such as the loss of respect for life. Along with fear, it is argued that permitting euthanasia opens up a network that may lead to involuntary euthanasia. Furthermore, There are fears of legalization leading to minimalization in attempts to preserve life. In a society as obsessed with the cost of healthcare and the principle of utility, the dangers of a slippery slope are far from fantasy. Assisted suicide is a halfway house, a stop on the way to other forms of direct euthanasia. So too is voluntary euthanasia, a halfway house to the involuntary and non-voluntary euthanasia.
In contrast to these negatives, there are a number of reasons to support the legalisation of euthanasia. To end someone's suffering, in no way does it sound as if it is brutally murdering or taking someone's life without their consent. It is for some the only option for relief from the pain and struggling that they are experiencing.
Patients who have requested to end their life through the use of euthanasia are unable to see a point in prolonging a life where they will inevitably be suffering, potentially and most likely in physical pain and possibly suffering poor mental and social health. They would much rather be remembered for the person they were before their quality of life was diminished from their illness. One individual who chose to euthanize himself, Don Flounders, stated that he had reached the point where his quality of life was dreadful. He was dependent on Iris, his wife, and his world had shrunk to his small bedroom. This was no life. The legalisation of euthanasia aims to provide a humane option to end a patient's painful suffering, preventing them from resorting to alternative options, which includes committing suicide, something that some people are too infirm or weak to attempt, refusing further treatment, and essentially starving their bodies of essential nutrients and care until they can no longer function anymore. Another alternative would be for individuals to move to a country that has legalised the use of euthanasia, which was done by two individuals. We come back to Don and his wife, Iris Flounders. The couple said they resented the fact that they had to travel halfway around the world to Mexico to have the choice of a peaceful death. This alternative, while providing individuals who wish to be euthanized with the means of doing so, has the potential to take them away from their loved ones in order for them to end their dreadful lives. The support and love of loved ones is something no person should have to give up in order to relieve their pain and suffering.
Due to the life expectancy of the modern day person being significantly higher in years than it has been in previous decades, that doesn't always equate to an increased quality of life in later years, yet allowing people to choose euthanasia, which refers to good death or to die well, allowing those who live in nursing homes who are not truly living a way to go out of this world in a dignified way. The real issue with euthanasia is more about how inhumane it is keeping someone alive whose quality of life is diminished. A doctor who is unconcerned about the quality of life is inhumane, and the real enemy is not death but the inhumanity. The concept of euthanasia allows those who are terminally ill or who are in extreme pain a way out of all the pain and suffering. This allows all their families a chance to say goodbye to their loved ones before watching them truly suffer. The concept of having the choice themselves whether or not the idea of living in pain is more satisfactory than ending their life on their terms is up to only the people involved. The positives outlined through euthanasia allow people who choose this pathway a dignified way out, as well as a way to end the extreme pain or suffering they endure. It should be considered as much of a crime to make someone live that does not wish to continue as it is to take life without consent. Why is it that we allow this process to take place every day in animals, but when it comes to humans we find it more cruel to end someone's life on their terms, rather than the real issue being the cruelness of keeping them alive when it is against their wishes? We dictate life and death with our species, but when it comes to ourselves we don't allow ourselves that choice.
Certain limitations would, of course, need to be put in place. These would include ensuring that the patient has the ability to change his or her mind until their last moment of life, and consulting and coming to the conclusion of the use of euthanasia on an individual through examinations and discussions with multiple doctors. This ensures that options are not biased to what is best for anyone other than the patient themselves. This would be done to ensure that doctors do not take advantage of euthanasia to make their work easier should they be given the option to get rid of a critically ill patient. However, it helps to guarantee that decisions are focused entirely around the individual patient's wants and or needs.
In making euthanasia applicable in the healthcare setting, procedure to prevent malpractice coupled with mental health measures for practitioners and families should be incorporated. Individuals responsible for administering the lethal overdose should be separately trained healthcare individuals to practicing doctors as to not breach the Hippocratic Oath. Mechanisms should be put in place for these individuals so that they may receive similar training to that of executioners, so that they can cope with the trauma associated with euthanasia. Also, it should be necessary that patients fulfill a specific criteria. According to the Rights of the Terminally Ill Act 1995, which was nullified by the federal government, the individual must be over 18, have the request of 3 supporting doctors who verify the illness and that the patient is not depressed, as well as that the patient has had time to consider after the decision of euthanasia has been made. However, it is a predominance of religious and conservative opinion in a society which is steadily becoming more secular which has halted the legislation of euthanasia. It is a choice that should be afforded to those facing untold pain, and with the correct restrictions should be allowed for those who seek its benefits. To euthanize or not to euthanize? That is the question. Pro-life groups, such as the Right to Life, are adamant that this voluntary form of death is without dignity or respect for the sacred nature of life. We are inclined to disagree. Whilst we are afforded the opportunity to terminate the lives of unborn fetus and put down beloved pets when we determine that the level of suffering is too great, the right is denied to us at an age where we are able to think for ourselves. We do not consider it acceptable that euthanasia is only afforded to the voiceless as an act of sympathy. This is not a matter of suicide, or as a more dramatically perceived, as the killing of the weak. To legalise euthanasia in Australia is to afford a choice to those who have had suffering and pain thrust upon them in the form of terminal illness. Death will always be the end game, it's just a matter of how we get there. Now please think on this issue. Do not push it from your minds. What are your personal opinions on euthanasia? Do you think that there are grounds for euthanasia to be legalised within Australia? Be true to your own thinking, rather than depending on others to do it for you. Many are needlessly condemned to suffering by the chief anti-euthanasia argument that murder might lurk under the cloak of kindness. Thank you.